Welcome, and thank you for joining us today. My name is Janice Butchko. I'm Assistant Director of Patient Care at the MDS Foundation, and joining me today is Ashley Moncrief, Director of Patient Care. We will be moderating today's webinar. Before we get started, I would like to provide a brief overview of the MDS Foundation. The MDS Foundation is a global nonprofit organization dedicated to supporting patients and caregivers affected by MDS, a group of rare and life-threatening bone marrow disorders, and the healthcare professionals who are committed to caring for and ultimately curing these rare cancers. Since our founding more than 30 years ago, the MDS Foundation has remained steadfast in our mission to advance research, provide critical education and support services, and improve treatment options for those impacted by MDS. We built a strong global network connecting patients, caregivers, and healthcare professionals with vital resources, education, and support. To name a few, here are some key resources that are available for you. Patient and family forums. We hold 6 across the U.S. every year. These programs provide an opportunity for patients and loved ones to connect with others going through a similar experience and learn more about MDS. These forums are led by an MDS Center of Excellence expert. We also hold an international patient forum every 2 years at our International Congress, and this year we'll be holding one in Rotterdam, the Netherlands, on May 10th. Webinars. We hold 4 virtual webinars a year on a variety of topics to enable patients and their caregivers access to critical disease, ask questions of an expert, and receive support information without having to travel. Disease-specific materials. We offer several valuable resources available via print or download for patients, caregivers, and healthcare professionals that provide comprehensive disease-specific information to help you have the information needed to make the most informed decisions for care. Clinical trial awareness. We also provide a clinical trial matching platform on our website, and through our patient liaison, share new clinical information with patients so you can always be informed about and access the latest treatments. Support groups. We host in-person and virtual support groups around the world and encourage you to reach out to visit our website to learn more. MDS Exchange. The MDS Exchange is a dedicated online community where patients and caregivers can connect, share experiences, and support one another. It is easy to use and powered by cutting-edge technology that enables the MDS Exchange to enhance engagement, deliver deeper insights, and strengthen community connections. And finally, we have 4 Move for MDS walks across the country that are great opportunities to not only raise awareness of this disease, but to connect with others. This year, we are hosting walks in Tampa on April 27th, that would be tomorrow, Chicago, May 18th, New York City, September 14th, and Boston, and also our virtual walk on October 19th. For more information and access to these resources, please visit the MDS Foundation website at www.mds-foundation.org. Today's webinar is being recorded, so it will be available for on-demand viewing on our website in 7 business days. The live question and answer segment will be available for all participants after the live presentation. You can submit your questions via the Q&A button on the bottom menu bar. I would also I'd like to give a special thank you to Tayo Oncology for supporting this webinar program. Now it is my pleasure to kick off the Caregiver Burnout webinar. Many of you have shared that this is a pressing topic for you, and we are pleased to have an expert lead this session to help you manage some of the challenges of being a caregiver. Today's presenter is Dr. Sandra Kurtin. Dr. Kurtin is the Director of Advanced Practice in Hematology and Oncology Nurse Practitioner at the University of Arizona Cancer Center, where she has practiced for 39 years, 31 of those in advanced practice. She is an Assistant Professor of Clinical Medicine and Adjunct Clinical Professor of Nursing at the University of Arizona. Dr. Kurtin is involved in several professional hematology and oncology organizations and is the immediate past president of the Advanced Practitioner Society for Hematology and Oncology. Dr. Kurtin is a member of the MDS Foundation Board of Directors, chair of the MDS Foundation Nursing Advisory Board, and editor and author of The Building Blocks of Hope, one of our critical resources for patients and caregivers that is available for download on our website. It's my pleasure to introduce Dr. Sandra Kurtin.
Thank you very much, Janet, and welcome everyone. We're going to spend the next several minutes really talking about caregiving. I always use the phrase that, cancer is a team sport. It really does take a team, and we cannot do this work without our caregivers. So I want to start by providing a little bit of background just to look at caregiver support. And we know that the world population is aging, that by 2080, persons age 65 or older will outnumber children under the age of 18. We also know that 65 plus year individuals will reach roughly a quarter of our population by 2050. We know most cancer survivors are over the age of 65. We know that particularly for MDS, that the mean age at diagnosis is closer to the age 70. So we have an older group of patients. And if you think about the primary caregivers often being spouses, those caregivers are going to be a similar age group. We also know that greater than 40% of cancer survivors over the age of 65 have more than one illness, so comorbidities. So not just MDS, for instance, but perhaps arthritis or heart disease or other illnesses. Excuse me. We also know that there's been a major shift over the last probably 2 decades, but certainly recently, where the bulk of our care is provided in an outpatient setting. And that really then puts the ownership on the patient and their caregiver because the care is episodic in the outpatient setting. So as opposed to being in the hospital, which is not where people generally want to be anyway, where you have people there 24/7, you are really doing this work yourselves. And that comes with many challenges, and I'll get into some of that here in a minute before we have our question and answer. I love this quote from Rosalind Carter. It says, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, and those who will be caregivers and will need caregivers. And so again, we can't do this work without you. So what is caregiving? Well, if we just look at, definitions, the lived experience of caring, it's interactive, it's fluid, it's continuous, involves humans, shared experiences, language and actions that are nurturing and supportive, and they can be fraught with, abrupt transitions. So a lot of dynamics. It's not a stagnant state. We know that there are what we call formal caregivers and informal caregivers. We have professional caregivers, nurses, physicians, advanced practitioners, other healthcare providers. But there are a lot of informal caregivers, and these may not be family members. It could be a neighbor. It could be somebody in your faith group. It can be people with a variety of relationships to the patient. But this is uncompensated work. So these are people that are not getting paid generally to do the caring. And our healthcare system, particularly in the United States and largely across the world, relies on informal caregivers to help us take care of patients. So what are the elements of the caregiver role? Well, I love this phrase too. An individual doesn't get cancer, a family does. So it affects everyone around the patient with the diagnosis, in this case of MDS. And the challenges are balancing medical expectations while maintaining hope, listening, and providing reassurance is a big part of it. That's just the tip of the iceberg, however, because there are elements of direct care. So monitoring and recording treatment side effects. When patients come to see us in the clinic, we talk about, what is the plan? And then we talk about what are the things that I need you to do to help me take care of you and keep track of. So the next time that we see you, we can review all of that information. We have many drugs that are administered orally, by mouth. And so either primary therapies or supportive care medications. And so the ability to deliver those medications to the patient in the right sequence and time, with food, without food, all of the things that are involved. And that doesn't just mean the treatment for the MDS, but also any of the other medications a patient might be taking to manage their other illnesses. When to call a healthcare provider. Often what we talk about in our visits, or at least in my visits with patients, is these are the things I need you to call us about right away. If you need to call the on-call provider, but being able to make that distinction and act on that information is something we, again, count on the caregiver and the patient to follow through on. When you have medicines that are given to you to manage symptoms, deciding when to use those medicines is also part of an expectation. And then in some cases, we have caregivers, taking care of lines, PICC lines or other catheters that might be in place for treatment purposes. There may be other kinds of skilled care. And then again, communicating with healthcare providers, either by phone, through the patient portal, or other mechanisms. Then there is just life, managing life, care coordination in life, transportation, accompanying a patient to appointments, being the hub to communicate to other family members, friends, being a gatekeeper and an advocate. So there's a multifaceted role in just managing the communication, keeping the house going, household maintenance, financial maintenance, shopping, cooking, availability in the case of emergencies, completing all the medical forms, keeping track of bills, applying for assistance, and just general engagement to the healthcare system. So the healthcare systems are not easy to navigate. And so there's an enormous amount of responsibility placed on both the patient, but also on the caregivers. And this is a continuous process, as I said in the beginning. It's complex, it's multidimensional, it's cyclic. So good day, bad days, hopefully more good days than bad. It requires a lot of skills, both in terms of communication, but also learning about the disease, learning about the things we are trying to do to treat the disease and manage the symptoms, and then learning again how to really navigate the healthcare system that you're in. And again, we don't often do enough to provide this kind of training and information to caregivers. It's just assumed that people are going to become a caregiver and take part in all of these things. So our systems don't do enough to really train the caregiver. So let's talk now about the caregiver. We talked about the dynamics of being a caregiver, what is caring. We know that with the shift in the population, that there are a lot of caregivers that are taking care of young children, but also older parents. And so that's another dynamic that I didn't really mention. But what does that mean to you as a caregiver? Well, certainly physical health, there can be pain just from the physical nature sometimes of being a caregiver, loss of physical strength, just, being tired. Sleep disorders are not uncommon. Changes in appetite, changes in libido. And again, because caregivers are often in that same age group as our patients, they may have their own health problems that they're trying to manage. And the MDS patient may also be a caregiver of their spouse, and so, or another family member. And so this can be very challenging if you have health issues in both the MDS patient and in the primary caregivers. We also know that this can very much disrupt normal routines. And so I often talk to patients about what can I do as a healthcare provider to make it so that you spend more time with your family and your friends than you do with us. How can we simplify your treatment process and supportive care process so that we are allowing you as much time away from us as feasible, but also are supporting you in that process. This can sometimes create social isolation, and particularly when people have more acute illnesses, or they may have episodes of hospitalization, and it's very difficult to maintain connections with your family and friends, and so social isolation can really be a big problem, and that can also lead into depression and anxiety, and other sleep problems. So these things are very much interrelated. We also know that for people that are still working or younger, this may interfere with your ability to maintain employment, which then adds financial strain, and you may lose that a connection with some of your colleagues that is important to your how you view yourself and what you've accomplished in your lifetime. So it can have significant impacts. Some of those emotional problems I mentioned, anxiety, fear, and uncertainty, are fairly universal across most cancer patients, but just not knowing what's coming, or having a sense of despair or worry that something unfavorable might be coming. I mentioned depression. I think it is fairly common across most cancer patients, episodic, and again, our healthcare systems don't always do an adequate job of managing mental health issues. Certainly sorrow, the sense of loss. We talked a little bit about some of the reasons for that. Feeling inadequate. I always say, when you get married, or at least when I got married, you always say in sickness and in health. And we don't really fully understand what that in illness means. There's no subtext to say including but not limited to, all of these things. And so the scope of being a caregiver in the setting of a serious illness is something that we don't often really understand, and can put a lot of strain and a feeling like you're not in control of the situation, or you don't really have the skills to do all the things we're talking about. And that may lead to feeling, a sense of powerlessness. The financial problems are real. if a person is working, there may be the need for time off, whether you have sick leave or not, either for the patient or the caregiver or both. And that can lead to difficulty in keeping up with bills, managing health claims, accessing retirement funds prematurely, not being able to contribute to the retirement account, and losing your employer match if you're still at an age where you are working. So it can have significant impacts on that. So it's a lot. It's a lot, and it's every day. And so I really try to help my patients think about a caregiver team. So who's on my team, and what can those team members do? And then what do we need to do as healthcare professionals and as advocacy organizations in terms of the MDS Foundation to care for the caregiver? So this is an excellent handbook, Caring for the Caregiver, that is provided by the National Cancer Institute, and it's free. You can download it. And it has some very, very specific recommendations and suggestions on how to access various resources, but also how you take care of yourself. So what are some of the informational needs? I know we've done surveys, patient and caregiver surveys through the MDS Foundation over many, many years. And I think, just really understanding what is MDS, what I can expect for my loved one who has MDS, what is our expected outcome. So really understanding the disease, the treatment, and the strategies for managing some of the symptoms. Where do complementary and alternative therapies come into play? I have a lot of patients asking me about various things that, can they take them? Is it safe? We want to have that conversation. It's important for us to know everything that you might be taking or considering taking, and we can help navigate through that process of, are there any potential drug interactions or problems that might arise in doing those things simultaneously? What's an option for a second opinion? It's very important to feel like you have a connection with your healthcare provider and the healthcare provider team. And it is never, or I would say I always say to patients, getting a second opinion is a right, and that it's not anything that we would ever discourage, or I would ever discourage, because that's your right, and getting more information is a good thing. So that's something to consider if you are feeling like you need more information, or there isn't that sense of connection to the team that you have. Really talking through the insurance coverage and out-of-pocket expenses, and I know that varies by region in the world, and whether there are co-pays and how much is this going to cost me, but asking those questions up front is really important. In the Building Blocks of Hope, there's a section that speaks to preparing for a visit and being able to really organize your thoughts and get ready to go in to see your healthcare provider, either physician or other team member. And really focusing on, I will say to patients, just, make a list. And when you get to your appointment, say, these are the 3 things I need to talk to you about today, because visits are too short and you may forget if you don't have it written down. So really a good idea. And often, as I said in the last few slides, we require on the caregivers to be that person who reminds and focuses on, these are the things we need to get answered. I think the other things is, how do I take care of myself? What are the nutritional guidelines, activity guidelines for the patient? Good nutrition and activity, exercise is very important for the patient. It's also important for the caregiver. We don't want caregivers to get run down and get sick themselves. So really taking care of yourself as well as the patient is critically important. When and who to call for help, get that information, have it written down somewhere. When do I need to call in an emergency? And then if you're in a hospital setting or in a clinic, what are the rules of visitation, children's supplies, how long are the appointments? And then record keeping is really important. That's particularly important if you have caregivers or providers, healthcare providers in more than one healthcare system. And that's actually very common. So your cardiologist is in one group and your hematologist is in another group. And then you have a whatever other ologist, and they're not in one organization and they can't easily see each other's notes. Or in where I live in Tucson, Arizona, we have a lot of winter visitors and they spend part of the year one place and part of the year here with us. And so communicating across providers can be challenging. So really having patients keep track of their information is very, very helpful, and can really help you get the information to the provider so that they can help you with your healthcare need. What are some of the support services? I think there are support groups. You're here today, which is fantastic. There are disease specific. I know through the MDS Foundation, there are ways to connect. You heard about the MDS Exchange and other support groups that are out there. So I really encourage you to get back to the MDS Foundation and find out what might be available in your area. There are transplants. So sorry for the lingo. HSCT is a hematopoietic stem cell transplant. And for those patients who have gone to transplant, there are additional groups that might be available to you. So you're speaking to people that have had a similar experience. And then there are general support groups that you may, as a caregiver, find are helpful to you. And I think caregiver support groups are, there's been a push more recently to try to formalize this. I know there are people that have Facebook groups and other online or social media connections in that way. Drug assistance programs, it's always good to ask about that if you're particularly on an oral medication or where you need assistance in the donut hole if you have Medicare. So ask about that in your program. And then certainly spiritual, religious, and cultural support. So everybody has, there's not one way, opportunities to reach out to various other groups in your area, in your community, to seek out assistance and in just the day-to-day work of being a patient and a caregiver. We talked about providers, families, and friends. Who is your team? And sometimes that's a neighbor. It could be volunteers. There's a lot of different options. Communication skills and resources, we talked about how critical those are. Get on a patient portal for whoever your careologists are, not just your MDS team, but your other teams. If there are patient portals, that's very critical to communicate effectively with your team. Also, if there are portals for laboratory, we have a number of patients who have to get their labs done outside of our clinic because of insurance concerns. And often they can bring their results on their phones before I can get a hard copy faxed to me. So being able to access your information, assign proxy, you're able to assign either to your spouse or your child, whoever your primary caregiver is, and there can be more than one that can access that information for you. So find out about how to assign proxy. And then in-home assistance. This is not always easy because, at least in the United States, we do a terrible job of reimbursement for care at home unless it's skilled care. physical therapy or occupational therapy, we can make referrals for physical therapy and occupational therapy and at least get that started, and then give you a list of things you can do with the patient and maybe yourself on your own, but ask about that as an option. Custodial care is not usually covered unless a person is really homebound. So understanding the rules of home care where you live is important. And then household work. Sometimes, this again is generally out of pocket, but maybe that's part of your caregiver team, is who can I get to help me just come tidy up or do this or that, go to the grocery store for me. So many of the grocery stores now have delivery services. Think about that, take advantage of it. I just was visiting my daughter-in-law, my granddaughters, my son, and they have done this since COVID started and haven't given it up. And it works very well for them, where they just do the shopping online or on their phone, and it gets delivered directly to their house. And how do you take care of yourself? Really focus on your needs too. It's really easy to get to where you're giving all of your energy to the patient and not really factoring in what you need for yourself. And again, it's critically important. We don't want to sacrifice the caregiver because then what's going to happen? So it's just like when you get on a flight and they say, put your mask on first and then help others. You really need to find that time and carve away time to take care of yourself. So ask for help. Give people very detailed instructions on what you need. Apply the concept of nutrition, exercise, and sleep that we recommend for the patient to yourself. Find ways to participate in relaxation or meditation. There are a number of online programs that are free that you can either get on your phone or on your computer, your laptop, to just spend 10 or 15 minutes even. Talk to your own healthcare provider about intimacy, sexual health, spirituality, whoever your person is for your spirituality. Doesn't necessarily need to be a church or just whatever that means to you. Find that person or friend or colleague where you can really talk through that. Talk to your healthcare provider about your own depression and anxiety, and then just try to strike a balance each day. And that's easier said than done. And I completely understand that. But you really need to make a list and think about, how do I need to tackle this process of being a caregiver? Be specific. So say, I need you to do X with cooking, cleaning, shopping, yard work, childcare, or elder care. Give people a very specific task. Talk with you and share your feelings. So I might need you to just sit with me and with me talk to you about how I'm feeling and help me think about what I can do to help myself. Again, help with doctor's visits, picking up the kids, whatever that is. Make a calendar, make a list, and really try to get a handle on what are all the elements of the things I need to do each week, day to day, to get through my day individually and through the week, including the needs of the MDS patient. And how do I balance all of that? And again, who are my people? Who is on my team? This is the Building Blocks of Hope. There is a section in the Building Blocks of Hope that talks about caregiving specifically, and living with MDS every day with the patient as a caregiver. And there are a number of other resources. So if you download the Building Blocks of Hope, these links will take you to some of the other resources that are out there that offer additional information and strategies. One of the other really big things, and this is something that has really taken hold, is shared decision making. We need to do better at having conversations about what are your wishes, what are your goals, both as a patient and a caregiver, and then what are our recommendations based on the science for you specifically, given the diagnosis that you are dealing with. And we need to have a two-way conversation to work out the best option. So this is an acronym SHARE that really talks about seeking patient and caregiver participation, helping the caregivers and the patients explore and compare the treatment options, looking at values and preferences, and then coming to a decision together to say, here's how I want to do this, understanding what that means to me in terms of outcomes. And there is no right way to be a caregiver. And so these are some other, I think, quotes that resonate with me. Life isn't about avoiding suffering, it's about creating meaning. This comes from When Breath Becomes Air, a great book. And that's really what we try to achieve. Again, not spending all your time with us, spend your time creating meaning and memories, but also trying to help you feel as well as you can, both as the patient and the caregiver in that process. And then another quote here: "Do any human beings ever realize life while they live it? Every minute." And so, really focusing on trying to find ways to make more good days than bad. And then the last quote is that if there's one thing that comes out of taking care of someone, it's that I've learned what's important really fast. And that's a lesson I will carry with me forever. So setting those priorities, really figuring out what can I cut out of my busy life, perhaps, that is not necessarily fulfilling me in a way that I need while I'm dealing with this challenging time in my life. So, and that can be hard to let go of some things and allow yourself time to focus on yourselves as caregivers and how you can be well and take care of yourself and still be able to provide care to your loved one. And with that, I'll stop and I'll see if there are any questions.
Hi, this is Ashley with the MDS Foundation. I will be helping with the Q&A portion to help read the questions that come up. So please do put your questions in as they come up. So the first one is tips for how to manage fatigue.
Yeah, so fatigue is universal and it's very challenging. It's universal across all cancer patients. And what I've learned in my experience is, the one thing that has proven benefit through all the years is exercise. And I know that sounds crazy when you're really tired to tell you to exercise, but it doesn't have to be big. So I tell patients, get some of those elastic bands, and the flat ones. You can sit in a chair so that you're not worried about falling. And you basically are going to loop that band into your hands, put it under one foot, and it's one motion. You're pulling your arms while you're pushing your foot out. And that's going to give you exercise to your quads, the thighs. Those are the muscles that you need to get in and out of a car, out of bed, off the toilet, all of the daily things. It's also where you hold a lot of your stamina, and those muscles get weak very quickly. And when they're weak, that's when you're more at risk for a fall. It also strengthens the muscles in your arms that you need to do everything else. Brush your teeth, wash your hair, get dressed, fix a meal, take your medicines, all the other things. So doing that one little motion. I also tell patients, just do mini squats. Hold on to a counter so you're stable, and you just are going to barely dip down, to strengthen the backs of your legs. That'll really help you. And then just try to walk, even if it's a short distance. And what you'll find as you're doing the strength training and the short walks is that gradually over time you can build stamina, and that actually is going to improve your fatigue. And that's where a physical therapy or occupational therapy consultation might help you, so that they can guide you in exercises that are realistic for you and where you won't injure yourself. And then the second piece is nutrition. So getting adequate protein and calories is probably the most critical thing. I try very hard to have patients not go to these extreme diets during this period of time. If there was a magic diet, we would be telling everybody to do that. There have been a lot of prevention studies. We at the University of Arizona have a very strong cancer prevention program, and also Andrew Weil Center for Integrative Medicine. And a lot of what we've learned is that balance is the key. So having a balanced diet, getting the right kind of nutrients in the right balance, particularly for the patient during treatment, but also for the caregiver, is really critical during this time. So if you have access to a dietitian, a nutritional specialist, take that advantage of that, so that you can learn how best to build the right nutrients to give you better energy. And then the last piece of it, two things: hydration. Being dehydrated really zaps your energy. So really finding out what is the amount of fluid that's right for you based on where you live. I'm in Arizona. It's hot and dry. We have no humidity. People get dehydrated even without going outside. So we tend to have recommendations for a little more fluids, things without caffeine. It doesn't mean you can't have caffeine, but you need things to hydrate you. So water is always best. And then the last thing is sleep. And it sounds like that should just be happening, but also as a caregiver, as a patient, both, talk to your healthcare team about what are my best options for sleep. Often the exercise itself will also aid in sleep. If you're not sleeping because your mind is going and you're worrying and all of those things, ask to talk to a behavioral specialist, ask to speak to a psychologist, somebody who can really help you manage those worries that might be preventing adequate sleep. So those would be my recommendations for fatigue.
You. Another one that I get often through the foundation is, can you speak a little bit about caregiver guilt? I have some caregivers who feel guilty for taking care of themselves when they're also taking care of someone else.
Like I said, we can't do it without you. We need you to be well so that you can be a caregiver. And that requires taking time for yourself. And so there should not be a sense of guilt, but it also takes work. Because if you are the only one, then there's nobody to give you that time. And then you're going to feel, sometimes people become angry and feel like, they're taking the burden, like, why am I having to do all of these things? And that's not where you want to be. So it's a slippery slope to really find and maintain that balance day to day to day, particularly if you're in a situation, for instance, like a bone marrow transplant, where you have to have a caregiver in order to have a transplant. It's required. So we really try to get people to figure out who are my backup people, and then plan it out and say, I am going to need to do this or this or this on these days, and here's my plan for a backup. Much like we would do if you were making a plan for your young children. and saying, I'm going to have a babysitter on Monday at 5, or what. It's not the same exactly, but it's the same concept. So it takes organization to get a plan in place so that you can allow yourself that time and not feel guilty about it.
Great. Another good question is, how do you best manage patients' lack of interest in activities?
Yeah. And that comes from fatigue. It comes from worry. It comes from that, the sense of or loss of hope, sometimes depression and anxiety. And so understanding what are the drivers of that lack of interest and growing isolation is really important. And the first step is to talk about it. And so I always really say to people, good for you, and thank you for saying that, because now it's this thing out here that we can say, okay, this is a thing and we need to work on that thing, just like we would work on your blood counts or managing any other symptom. It requires a plan, and talking about it is really the first step so you can get to what the root cause is.
Great. And also another great question from a caregiver. So my husband is very weak and has no appetite. What is the best nutritional drink if I were to recommend something?
Yeah, that's tricky because it depends on, do you have diabetes? Do you have hypertension? Do you have other things that are restricting what you might be able to use? There are a lot of protein drinks. There are a lot of supplements that are out there in terms of powders and things that you can add to something that you would make like a smoothie. There's not one magic thing. That's where I think it's really important to talk to your team and say, what do you recommend for me? Or do you have a dietitian that I might speak to that could go through with me my health profile, and also what, my weight, my age, my kidney function, and what's the best source of nutrition for me. So it's hard to give you one answer because it really depends on what else is going on with the patient.
Great. One question that I get, so the change in landscape as you go through your MDS journey from watch and wait to transplant is pretty vast. So at what point do you get that caregiver and get them established? People tend to wait a little bit to ask for help. So does that start when you're still in watch and wait, or do you, at what point do you incorporate that?
I think that, I really try to get people to think about it right from the get-go. And because you never know when you might have, an emergency, and it's, and some people do not have an extensive network of caregivers. So really thinking about, who are your people is important. And we start having those conversations just in getting to know the patient as an individual and not just a disease, to learn a little bit about, tell me about your, what are you working? Yes. Where do you work? What do you do? What are the things you do for enjoyment? Just really knowing the person as a human, and then really understanding, who do they have available to them? Because once you have an illness, not just MDS, but any illness, you can have things happen even without an illness. Accidents happen, unexpected things happen. So having people just really start thinking about it and talking about it right at the beginning, I think, is really important. We always do look at, certainly in higher risk patients, are they a transplant candidate? And we start having that conversation right away, that's something that might be in the long-term plan. And will require a caregiver. And sometimes people need to work at building a team. And that can And so helping them get started in that conversation right away is what I do.
Great. Another question I get often, so you talked about, I know caregivers have multiple comorbidities and
Yeah.
those can get worse with, lack of focus on oneself, but can the stress alone from being a caregiver make you more prone to illness, like
Sure.
physical illness?
Well, that can make anybody more prone to illness. Your body can only take so much. And, when you're worn down, when you're not sleeping well, you're not eating well, that's when people get sick. And then if you have underlying or pre-existing comorbidities, other illnesses that maybe, you've had sort of semi-controlled, you just, you start piling things on and your body is just like timeout. That's it. And you get sick. And so again, really taking care of yourself as a caregiver is super important, very, very critical to being able to continue to be a caregiver for the MDS patient.
Another thing I get from caregivers is, how do you handle it if the patient and the caregiver have a difference in how much knowledge they want, right? Sometimes patients want to
Sure.
know everything, or sometimes the caregiver does, but the other one doesn't. So how do you handle that discrepancy?
Yeah, and I think that's where shared decision making comes in. I'm a firm believer in transparency and telling people what we know. There are patients who will tell you, I don't want to know all that. And we work through, how do we get you enough information so that you have informed consent and you know what we're doing. It doesn't mean you have to dwell on things, but it's very individualized. I also, in the personal practice, really try to speak directly to the patient and let other people speak for them if they're able to speak for themselves, so that we are really talking to the patient. But I also engaged, the caregivers. I often call them the truth squad. You'll have a patient come and they say, "Oh, I'm fine," and there's the person over in the back of the room going, "Nope, nope." And we need to know those things. The other thing I say is, I can't help you if you don't tell me. So in order to help you through symptoms or problems, we need to know about them. And sometimes the patient isn't the best at letting you know, but the caregivers will be able to describe what's going on so that we can try to make it better, or identify the strategies that they can apply to make it better. So it's very individualized. Again, the dynamics vary from, widely. It's our jobs as healthcare professionals to understand the dynamics within, patient, caregiver, family, friend, whatever is going on, and do our very best to guide the patient and help the caregivers as well.
Great. That was a really great answer. Another one we have is, do you have any tips on how to engage relatives in the support team if they already have a busy life?
Sure. Again, we just talk through things. I think being as specific as we can in what is the plan, what does that mean day to day? Like, you're gonna come Monday through Friday to get this and do that. And then on the weeks after that, let's say you're getting, azacitidine, and we're giving you 5 days in a row. But then the next 3 weeks, you're going to come and we're going to check your blood and possibly give you transfusions or other support. And you're going to do that on Tuesdays and Fridays, or Mondays and Thursdays, or whatever it is. So it's our responsibility to give people a plan, a detailed plan, so they can make a plan and rally support, and also identify who might be on my team. And so you're not putting the burden on one person. And this is, I have many patients who have adult children, again, who have children of their own and also are helping to care for their parent or their aunt or their uncle. And it's not just one of them. It's my brother's going to do it on Tuesday and my sister's going to do it on Friday. So putting it on paper and making it, really black and white helps people see like, wow, okay, I have a gap here or a gap there, and who do I have that might be able to help me with that? And then reaching out to social workers, if you have access to those, to help identify any other resources for medical transport. The American Cancer Society, who often has volunteers to help drive people. So engaging all of those resources and plugging that into your grid is what it takes.
Really good question on how do you help a caregiver who essentially needs help but is not asking. So the question is, how can extended family members support the caregiver without pushing too hard for caregivers who are not open or not asking for help?
I think that the best way that I have found is to come to the appointments, because then it becomes a conversation, and the extra person can be there to really hear what's needed. But it's personal. Like, there are people who are, don't want to let other people in. It's their personal choice. But sometimes it's because they don't know how to ask and they don't know what to ask. And we can sometimes help guide that conversation. We also have had instances where a social worker will book a family meeting and just help people work through the details of what I've just been describing. So, but somebody has to start the conversation. And sometimes it's the patient who will say, my caregiver is overwhelmed and may get help for my caregiver. So that's important.
A great point. We do have a couple of questions that are not specifically caregiving related. I think that just MDS specific. I don't know if you have a little bit of time to address
Sure.
a few of those.
Yeah.
Okay, so this question came in. I have a low white blood cell count at 1.2 and have been prescribed levofloxacin, but I'm afraid to take it due to reported side effects. I asked if there was anything else I could take and was told that it was taken to raise the white blood count. Can I wait on taking it?
It doesn't help you raise the white blood cell count. It depends on why your blood counts are low. There are, it's very common in higher risk MDS, for instance, to use what we lovingly call azaven. So azacitidine plus venetoclax, the white blood cell count stays low for a very long time. The longer that it stays low, the more at risk you are for more serious infections, and levofloxacin is the drug of choice for that, just based on its coverage and compatibility with the other medicines. Patients who've had bone marrow transplants sometimes will stay low for a period of time until the marrow takes, and that's also a recommended drug in that scenario. So it really depends on why they're giving that drug. The side effects, probably the biggest thing people worry about is you can get a joint abnormality that is pretty rare, but that can happen. So I would just go through your concerns with whoever your prescribing provider is. Ask about alternatives, and then understand why they're recommending it for you. We don't want you to end up in the hospital with a life-threatening infection. And with a white count of 1.2, I'm guessing the neutrophil count is probably below 500, which puts you at significant risk for a serious infection. and where we would consider doing what we call prophylactic antibiotics, preventative antibiotics. So I would ask those questions.
That's great. I do have one more caregiving question. So can you speak a little bit, so if you're taking care of a patient and you are the caregiver, about FMLA, intermittent FMLA, who do you take that paperwork to? Is someone in the clinic who can fill that out?
Yes. So in our team, we have a staff designated to help with that kind of paperwork. We fill it out as providers. We have to sign off on it. So getting that, and we generally talk, that's a really good question, and I didn't really put that in my talk, but I should have, because we do, for caregivers who are working, we do immediately recommend that they look into the FMLA policy, both for the patient if they're younger and working, but also for the caregivers right away if the patient's on treatment, so that they're protected in their job. So most organizations have a specific form. It's not a universal form. So you have to get with your HR department, human resource department, get the FMLA paperwork, and then find out, does my healthcare provider team need to send it directly in? Do I get it from them and bring it in? So how it's processed in your organization, but get it started right away so that you're protected. If you have an unexpected absence, it protects you from losing your job.
Great. A question for young children. So for younger patients with MDS with minor children, what strategies do you have to balance normalcy in the family and the imbalance that comes with bad days or hospitalizations? I know there's like child life specialist. Kind of what advice do you have there?
Right. So child life specialists, if you have access to those, I think this is also where you look at your caregiver team, and part of the caregiver team may be people that are going to help you with the kids and navigating. We have, I personally have a number of younger patients, and this is very challenging. They're trying to stay employed and take care of their family and take care of themselves, and the caregiver, the primary, the spouse, which is usually the default, is also trying to work and maintain employment so that they keep insurance, and it's very, very challenging. So again, notifying if they're in school or daycare, notifying those teachers about what's going on, and so that they can help add support for the child or children, be aware of the dynamics that are happening in the family so that they can give a little extra support. Are there resources in the schools that might offer some support? There are organizations that I know in our community that focus on kids whose parents have cancer. And so if you have that kind of a resource available in your community, also, it's a great idea for them to access those resources. And then just, again, who's my caregiver team, and is it for me, or is it for my kids, or maybe it's for my spouse? Who's my team?
Great. So a couple of questions that are not caregiving related again, is can you explain what happens when transfusions become frequent? And I think that does apply to caregivers as well.
Sure.
So explanation on that.
Yes. So when people become transfusion dependent, we know the bone is not keeping up, and it can't make the right kinds of cells. And so you can either be transfusion dependent for red blood cells or transfusion dependent for platelets. Red blood cells are by far more common. And the more blood you get, the more you're exposed to antibodies. And it can make it difficult to find blood that matches for you. It also obviously adds iron that you don't need. So iron overload becomes a concern, but it also takes time. And so I often use the analogy of being tethered, having your blood and then needing to say I need a transfusion, and then getting the type and cross, and then getting the transfusion itself. In our center, we're very lucky, spoiled, as we can have patients come get the blood drawn and give their transfusion all in a day, and that's not the norm. Many places it can take a week or so to get all of that done. And then if you're getting blood frequently, you start that process all over again. I think the other thing that we find is that after a while, you're getting less of a boost after the transfusion. So it's really about having a conversation with your healthcare team, with your physician or APP or whoever is seeing you at the time about, what are the numbers that what are my parameters for getting a transfusion, balancing the risk and the benefit of that. What are the outcome? Why am I needing more of a transfusion? Is there something else I can do to treat my MDS to make my bone marrow work better so I don't need so many transfusions? Those are the kinds of questions I would have you ask of your team.
Yep, sounds great. Another one is if you could talk a little bit about watch and wait, or really, as I've heard it called, watch and worry. What can you do? Is there anything you can do at that point besides just looking at the blood counts as either a patient or a caregiver?
No, I mean, I think that there's an evolving science in terms of the underlying molecular and cytogenetic abnormalities that are higher risk, where we expect a disease to behave more aggressively and would think about starting a disease-modifying therapy, sooner. There are supportive care measures that we would employ. All of these things have potential side effects, and so it's really a matter of, do we, as healthcare providers, believe that the risk of treatment outweighs the benefit at that moment in time. So there are some criteria we use to say you don't need anything, and knowing that you don't need anything, it isn't changing the trajectory of your disease. So we have to understand your risk category to say, given a very low risk disease, there's no advantage to treating you early. It's not going to extend your life, and we may make you sick in the meantime. That's the watch and worry piece, as opposed to someone with higher risk disease where we're going to really think about starting things sooner.
Great. 1 second, let me switch. At what point do you need to get a bone marrow biopsy is a good question.
Well, you should, if there's a concern for MDS, we need a bone marrow biopsy to really risk stratify your disease. Without a bone marrow biopsy, we cannot really tell you, that you have MDS. We can guess, but it requires a bone marrow biopsy to really make that diagnosis and give you or risk stratify your disease, tell you what risk category you're in, and then what does that mean to you in terms of prognosis and options for treatment. So we would do a bone marrow biopsy in anybody where we believe they have MDS. Or now there's the new science evolving around CHIP and ICUS and CCUS, which are precursor states where people carry or harbor these molecular or chromosomal abnormalities, and they may not meet the criteria for a diagnosis of MDS, but it has other relevance in terms of what we're going to do to monitor them. We can't today find out what we need to without doing a bone marrow biopsy.
This is a question I get quite a bit. So as far as resources that are available for caregivers and being an advocate for the caregivers, is there anything like legislation they can lobby for or organizations they can get involved in to try to, boost resources for fellow caregivers?
Sure. I mean, there's the CARE Act. There's some things that have happened over time that, things like FMLA, to allow people time off to be caregivers without using or without, worrying about losing their job. So they have paid time, hopefully. If they're out of PTO, they may not have paid time, but they can take time without pay. So those are, I think, the biggest things. I think learning about, state by state, some of those rules are variable. So just really educating yourself about what are the rules in the individual state or country that you're in about how caregivers are perceived, or what are the things that are being done to help caregivers, and are there any legislative initiatives that are ongoing either in your state or in your country that are important to know about, and then contact whoever your representative for the government is.
Great. Really great question came up. So as an MDS patient, how do we screen caregivers? Some who want to help may not be a good match with you.
Yeah. No, that's a really good point, because it's personal, right? I mean, people, into your personal life, and that can be uncomfortable if you are a private person and you aren't someone who is, out with a big network of people, or you are in a situation where you're trying to protect sort of your privacy and not let a big group of people in the know, because that can affect your employment or other elements of your life. And so, yes, that's tricky. And I think it's really about just starting with a list. We do have patients who've hired caregivers that have the resources to do that, to help in these gaps through professional organizations. It's very costly, unfortunately. But I think that it's really a personal and very individual process of how you begin to even identify the people that you might want to talk to. So making a list is always a good idea, and just thinking through, I feel comfortable talking to that person. And then if you have another person, a good friend or other confidant that can help you navigate that process, that's also a great idea or resource.
Thank you. Really good. Just a reminder, if you haven't put your questions in, we will be wrapping up soon. So if you could put your questions in our questions and answer box, or feel free to follow up via email. I was going to ask, one thing that I hear a lot is regarding infection prevention. So if you have a team of caregivers and there's multiple people on this team, how do you minimize the transmission of, viruses and respiratory things that are going around at that time?
Yeah, and that, this has been probably one of the worst viral seasons I can ever remember. So I've been now 40 years here in the same institution as of December. And it's been a really bad viral season since Thanksgiving, really. And so you make people wear a mask if you're very vulnerable. If your counts are low, they need to wear a mask. If they're around you, wash their hands. Don't come if you're sick. You limit hugs and that kind of thing, just the direct contact. And then just have a very serious conversation about if they have children who are ill, especially, in preschool or daycare, or their little petri dishes, and they tend to bring stuff back. Just being mindful of the caregiver needs to be mindful of their own symptoms and the risk of exposure. But generally, I see patients every day, all day. I wash my hands, I wear a mask. That helps prevent me from getting ill, even when I'm exposed to people who are ill. And then I'm not transmitting that to other patients. So I'm very mindful myself. It would be the same idea for a caregiver to have, guidelines on what they need to be able to do, what they need to do to protect the patient.
One question that we received before the webinar, and talking about, we always want to talk about hope and what's out there. So as far as curative options, are we only looking at transplant? Are there new things on the horizon?
So allogeneic stem cell transplant, which is not available to some people, either because of age or comorbidities or the lack of liver, is still the only potential cure for MDS and for most myeloid malignancies. So yeah, but there are other drugs on the horizon, and things always, new science that's very exciting. So we really do encourage patients, whenever possible, to participate in a clinical trial. That's the only way we get new drugs to market, is by having patients in clinical trials. So you should always ask, is there a clinical trial available to me? And that can, improve outcomes for some patients. I've seen that happen many times over my career. We don't have enough treatment options. We need more treatment options. We rely on patients being in clinical trials to be able to get new drugs to market that might offer longer term outcomes.
Thank you so much. I think the last question that we have, as far as clinical trials, how do caregivers share their experience? Are there trials they can participate in, or qualitative studies of sorts to get their opinions out?
There are caregiver studies that have been, some of them I referenced here in the talk, but that specifically engage caregivers and talk about the dynamics of caregiving and things to do to overcome barriers. So there aren't a lot. There's a particular study that was recently published that looked at what organizations across the country in the United States actually had caregiver training courses, which were way too few. So yes, there are studies that are done. They're generally done by people that are aligned with certain institutions, as opposed to a big organization. So I think participating in things like this through the MDS Foundation and other advocacy groups is a good start. And then asking in your own community if there is a caregiver group, even if they aren't caregivers of MDS. Some of the challenges that you face as a caregiver will look similar to people who have loved ones with different diseases, and just sharing ideas and resources about how to better equip yourself and take care of yourself as a caregiver can be, found in those groups. So again, just investigating what's available, having your friends or family members investigate for you is always a good idea.
Thank you so much. So thanks to Dr. Kurtin for being here today. I think that if I learned anything, it's that, asking for help as a caregiver or as a patient is not a sign of weakness. It's actually a sign of strength and, self-preservation. So definitely do that when you need to. Any last wrap-up words before we close?
No, just thank you all for joining. We are so glad that you have reached out to the MDS Foundation. Let us know how else we can help if you have suggestions for caregiver support. I think we're always open to new ideas, and then just, fully advocate for yourselves and take the time to start creating your team.
Perfect. Well, thank you everyone for joining us today and for engaging on this important topic. Please know the MDS Foundation is here for you, and if you ever need services or supports, please reach out. You can reach us at 1-800-637-0839, or you're welcome to email at patientliaison@mds-foundation.org. Both of those contact information pieces are available on the website. Janice will be sending out a survey, an email with a link to a survey for both this webinar and for our patient and caregiver survey. So we do want to hear from caregivers that your voice really does matter. So you'll be getting those links soon. And as she said at the beginning, it will be recorded. You can access this later. And then a special thanks to Taiho Oncology for making this possible. And I hope everyone has a great rest of your weekend. Thank you all.
Bye.